Acyanotic heart disease. What do we mean by acyanotic heart disease and cyanotic heart disease? In case of acyanotic heart disease, those heart disease which defect does not causing lack of oxygen is called acyanotic heart disease. And on other side, the cyanotic heart disease. Cyanotic heart disease causes lack of oxygen in the body. We will discuss it later. Cyanotic heart disease. Cyanotic heart disease causes lack of oxygen in the body, while acyanotic heart disease doesn't cause lack of oxygen in the body. Under acyanotic heart disease, we will discuss ASD, VSD, and PDA. Let's discuss individually. First of all, PDA, patent ductus arteriosus. Ductus arteriosus is a vessel. डक्टस आर्टेरियोसस ये एक ऐसा ब्लड वेसल होता है जो बर्थ के टाइम प्रेजेंट होता है. दिस आर्टरी इज प्रेजेंट एट द टाइम ऑफ बर्थ and it leads from bifurcation of the pulmonary artery. It arises from pulmonary artery to aorta. Okay, it arises from pulmonary artery to aorta. In adult cases, we do not see the ductus arteriosus. In adult circulation system, ductal arteriosus is absent. In case of at the time of birth, the ductus arteriosus is the blood vessel which connects the pulmonary artery to the aorta. Okay. It is present distal to the left subclavian artery. Okay. It closes functionally in 1 to 2 days after birth. It is present at the time of birth, but it closes after 1 to 2 days after birth. But anatomically in 10 to 21 days, persistent after 3 months, considered as abnormal. Okay. If the ductus arteriosus is present after 3 months of birth, it is considered abnormal case. Okay. Because it must be disappeared after birth in 1 to 2 days or 10 to 21 days completely from the system. PDA results when this failure to close the vessel occurs. If this closing doesn't occur, then PDA condition is termed. The ductus arteriosus is persistent, then patent extra word is prefixed to the ductus arteriosus and calling them the PDA. It results when this failure to close the vessel occurs. Okay. It often results from congenital rubella syndrome. Another very important part of this topic, congenital rubella syndrome. Any other pregnant female suffering from rubella infection, then the newborn baby can suffer from congenital rubella syndrome, causing trio of deafness, cataract, and PD or pulmonary stenosis. The newborn baby will suffer from congenital rubella syndrome, having trio of syndrome, deafness, cataract, PDA, or pulmonary stenosis. It is a cyanotic type of congenital heart disease with a shunt. Shunt is an abnormal flow of blood from one part of the heart to another part of the heart. Okay. तो पीडीए एक तरह का कॉन्जेनिटल हार्ट डिजीज है, एसाइनोटिक हार्ट डिजीज है, जिसमें डक्टस आर्टेरियोसिस नाम का एक वेसल होता है बर्थ के टाइम पे, जो कंप्लीटली डिसअपियर नहीं हो पाता है। ये जो ओपनिंग है, डक्टस आर्टेरियोसिस बिटवीन पल्मोनरी आर्टरी एंड ऑर्टा, ये ये जो ओपनिंग है, जब क्लोज नहीं हो पाता है, ये जब फेल हो जाता है, तब का कंडीशन ये कहलाता है पैटेंट डक्टस आर्टेरियोसिस। ओके, you can see the condition in this image. This is the aorta and this is the pulmonary artery. Okay, aorta is full of oxygenated blood while the pulmonary artery is full of deoxygenated blood, and both of these vessels are connected by the ductus arteriosus. And if it becomes persistent after birth, it is known as patent ductus arteriosus. Okay, चलिए next. अब आप लोग इस इमेज में कंप्लीटली क्लियरली देख सकते हैं पैटेंट डक्टस आर्टेरियोसस। You can see clearly patent ductus arteriosus. This red part is aorta and the blue part is pulmonary artery, and both are connected by ductus arteriosus. In case of PDA, patent ductus arteriosus, continuous murmur is seen. Which type of murmur we can see here? Continuous murmur. I have already given you the notes of all types of murmur in all cases of cardiology. Okay. In case of PDA, we can see the continuous murmur, which is based heard over the second intercostal space. It is not so much important to memorize. You must memorize this type of murmur. Continuous murmur is seen in case of PDA. Very important. This murmur is also called as machinery murmur. Several named murmurs we have already discussed. Another named murmur, machinery murmur or train internal murmur, we can see here in case of PDA, patent ductus arteriosus. Eisenmenger syndrome in congenital heart defect, which is at first associated with the left to right shunt, may lead to pulmonary hypertension and shunt reversal. If so, cyanosis develops, and this is called Eisenmenger syndrome. मतलब शंटिंग के कारण, ड्यू टू शंटिंग blood flow from one part to another part of the heart. If shunt is reversed, there is a condition of cyanosis. This condition is called Eisenmenger syndrome. Okay. Next, differential cyanosis. In PDA, upper limb is normal, whereas lower limb is cyanosed. You must memorize this condition. You must visualize this condition and keep in mind, very important. The upper limb is normal. The upper limb is normal and lower limb is cyanosed. This condition is called differential cyanosis. Okay. This condition is called differential cyanosis. This condition is called differential cyanosis. Which type of case is there? Upper limb is normal while lower limb is cyanosed. Okay. It is found in PDA. Very, very important. Many times it has already asked in our exam, PDA. The MCQ having question, differential cyanosis is seen in which case of heart disease? Your answer must be PDA. Next, maternal mortality rate is highest with Eisenmenger complex. What is Eisenmenger complex? There is a shunt reversal and development of cyanosis occur. This is called as Eisenmenger complex. Maternal mortality rate is highest Leading cause of death in PDA are the cardiac failure and infective endocarditis. Leading cause of death in PDA are cardiac failure. Okay. In case of PDA, patients becomes dead due to cardiac failure and infective endocarditis. Next. The next cyanotic heart disease is atrial septal defect. A cyanotic heart disease where a left to right shunt is seen. A left to right shunt is seen. In case of PDA, there also was shunting. Here also we can see the shunting. Case of shunting. What is shunting? Shunting means flow of blood from one part of the body directly into the another part of the body, another part of the heart. One part of the heart to another part of the heart flowing blood is termed shunt. There is wide fixed splitting, very important for ASD. Wide fixed splitting of the heart sound, which doesn't vary with the phases of respiration. Wide splitting also seen in MR and RBB. Wide splitting of a heart sound is also seen in mitral regurgitation and right bundle branch block. Most common type of ASD is ostium secundum. Let me clear first that ASD have two conditions. ASD have two conditions. First, ostium prima, primary ostium, and second, ostium secundum, secondary ostium. The primary ostium recovers very soon. It recovers very soon and it does not cause any abnormality in the heart. It recovers before birth. But the ostium secundum has very much chance to persist. So the most common type of ASD is ostium secundum. Okay. The ostium primum appears first and the ostium secundum appears in last after the first. But the ostium secundum doesn't recover. In that case, atrial septal defect is seen. In ASD, size of aorta is small. In case of ASD, size of aorta is small. Commonly associated with Down syndrome. ASD is associated with Down syndrome. Patients suffering from Down syndrome can show the symptoms of ASD. Paradoxical emboli is seen in ASD. Embolism is seen in ASD. In ostium secundum ASD, maximally affected is right atrium, then right ventricle, then left atrium. That is ostium secundum. In case of ostium secundum ASD, the right atrium is affected most, then right ventricle, and last left atrium. Next. The different syndromes are there associated with ASD. First is Ellis-Van Creveld syndrome. This is characterized by short limb, dwarfism, polydactyly, associated with ASD, having single atrium. You must answer the MCQ having question, which of the following heart condition has single atrium? Must answer the Ellis-Van Creveld syndrome. Very important and very popular part of the ASD topic. Lutem-Backer syndrome. ASD associated with MS. If the ASD associated with MS, it is called Lutem-Backer syndrome. Okay. If you find ASD plus MS in a single condition, then you must consider it as Lutem-Becker syndrome. Next, we have Holt-Oram syndrome. You can see here in the image, ASD is associated with MS. This is the condition of Lutem-Becker syndrome. Okay. And next syndrome, Holt-Oram syndrome, ASD associated with skeletal defect. If ASD is associated with a skeletal defect, this is also very, very important part of the ASD. Skeletal defect. You can see in this image. In this image, the child is suffering from ASD, having some skeletal defect, and this condition is called Holt-Oram syndrome. This condition has features like hypoplastic thumb, absent radial bone, and difficulty in a position of thumb. And thumb becomes the structure like rest of the fingers. You can see here, in one hand, thumb is lacking. Here the thumb is lacking, and in this hand, thumbs has structure alike to that of rest fingers. All the fingers are alike, including thumbs. So this condition is called Holt-Oram syndrome. You must remember with ASD plus skeletal defect. Okay, very, very important part of the ASD. Very, very important MCQ, Holt-Oram syndrome and Lutem-Becker syndrome. Next, ventricular septal defect. Third part of the cyanotic heart disease. It is the commonest congenital heart disease at birth. It is the commonest congenital heart disease at birth. Very important MCQ. The commonest congenital heart disease in birth is at birth. At birth, you must remember, this is the most common congenital heart disease at birth, not in adults. There is another answer for the congenital heart disease, the commonest congenital heart disease in adult. Here, in case of commonest congenital heart disease at birth, you can see here ventricular septal defect, commonly associated with Down syndrome, coarctation of aorta, ASD associated with Down syndrome, and COA associated with Turner syndrome. Okay, blood moves from left ventricle to the right ventricle. In this condition, blood moves from left ventricle to the right ventricle and then via lungs to left atrium, because here defect is in ventricles, ventricular septum. This causes hypertrophy of both ventricle. In case of VSD, you can see the hypertrophy of both ventricle and left atrium, along with pulmonary hypertension. Wide splitting of second heart sound is seen. Okay. Endocarditis is common complication of VSD. Presence of enlarged atrium on X-ray with differentiate ASD from VSD. Okay. In ASD, atrial septal defect is seen, and VSD, ventricular septal defect is seen, and both have wide splitting of the heart sound, And in case of VSD, you can see the presence of enlarged atrium. In case of ASD, we can see enlarged atrium. Okay. In case of VSD, hypertrophy of both ventricle is seen. You can see here in the image, ventricular septal defect. Next, we have cyanotic heart disease. The heart disease causing lack of oxygen in the body. Next, the first condition is tetralogy of Fallot. Very important part of the cardiology and central CVS for AIA-PGT examination, tetralogy of Fallot. Most common congenital cyanotic heart disease. This is most common congenital cyanotic heart disease. Okay, and it was the most common congenital heart disease in case of cyanotic heart disease, and this is the commonest congenital cyanotic heart disease. It has four component. That's why it is termed tetralogy. Pulmonary stenosis, right ventricular hypertrophy, overriding of aorta over the ventricular septum, and VSD. These four conditions are found in tetralogy of Fallot. Next, this slide has features of tetralogy of Fallot. Child assumes squatting position to get relief. This is the squatting position. Very less time has left. We will discuss it. We will discuss this topic in next class. Okay. Let me complete this slide. Child assumes squatting position to get relief. Squatting position to get relief in case of tetralogy of Fallot, because there is lack of oxygen in the body. This is the squatting position. Having this position, child becomes relieved. Squatting position gives relief because of compression of femoral artery, which increases resistance to left ventricular outflow, thus reducing the right to left shunt, and hence more blood goes to lungs for oxygenation. Okay. Secondly, compression of femoral vein reduces venous return, thus reducing the right ventricular pressure and hence right to left shunt. You have to memorize just this part. Squatting position is the relieving position for the patient. Next important part is central cyanosis present in severe cases. We have seen earlier that differential cyanosis. The differential cyanosis was seen in case of PD. Okay, and the central cyanosis is seen in case of tetralogy of Fallot because it's the already cyanotic heart disease. Clubbing of fingers is present. X-ray shows boot-shaped heart, very important, boot-shaped heart because of right ventricular hypertrophy. Due to right ventricular hypertrophy, the ventricles enlarges so much that it becomes boot-shaped. Cyanosis doesn't improve with 100% oxygen in tube. Single second heart sound is feature of TUF. This is the squatting position. Next part is coarctation of aorta. Narrowing of aorta, either distal to opening of ductus arteriosus or proximal to the opening of ductus arteriosus. Coarctation means narrowing of aorta. Coarctation of aorta means narrowing of aorta. Here in the aorta, you can see here the narrowing of aorta. Okay. Here also you can see the narrowing of aorta. What are the features of coarctation of aorta? PDA, bicuspid aortic valve, Turner syndrome, atresia of aortic arch. These are the conditions associated with the coarctation of aorta. And chest X-ray, very, very important MCQ. You will be asked which of the following condition has 3 sign in the chest X-ray. 3 sign. Let us see what is the 3 sign. It is very clear from this picture. The aorta has narrowness, the constriction-like appearance, showing producing figure 3 sign. If the aorta is narrowed, then this type of image has been created. The 3 sign you can see here in the X-ray, chest X-ray of 3 sign of coarctation. Okay, next, Sujman sign. In case of coarctation of aorta, there is established collateral circulation because the aorta has been narrowed. There establishes a collateral circulation between bronchial intercostal and the arteries around the scapula. This vulnerable arterial collateral is called Sujman sign. Then you must remember, and you'll be asked in the exam, Sujman sign is seen in very simple questions are asked in Aiapget exam. So you must remember just Sujman sign is seen in case of obstruction of aorta. Because of the tortuous bronchial arteries, the undersurface of ribs are notched. Okay. Notching of ribs is also found in this case. Additional features seen in type of obstruction of aorta is left arm is underdeveloped. The left arm is underdeveloped in which case of heart condition? Obstruction of aorta. The left arm is underdeveloped is seen in which case of heart condition? Obstruction of aorta. And heart condition associated with the ASD associated with the skeletal condition is called Holt Oram syndrome. Okay. Next, heart block. First SA block and second AB block. We will discuss the first SA block and second AB block. Okay. SA block is a condition where the impulses from the sinoatrial node are delayed or blocked. In SA node, if it is a heart, there is SA node situated. If SA block is, in case of SA block, impulses from SA node to next part of the heart are missing or delayed or blocked. A complete cardiac cycle is missed so that a gap appears in the pulse. Due to delayed or blocked or absent SA impulse, there is gap appeared in the pulse. You can see here from here to here, there is a gap of wave, gap of ECG due to gap of impulses. So due to SA block, we can see a gap of pulse. In case of heart block, SA block. Next, AB block. In case of AB block, three conditions are seen. First degree AB block, second degree AB block, and complete heart block. In case of first degree AB block, PR interval is prolonged. Okay. In case of second degree heart block, dropped beat occurs. Let's see what occurs here. Some impulses from the atria fail to get through to the ventricle. From atria to ventricle, impulses are fails to transmit. So there we can see a dropped beat occur. That is, a wave, a part of wave is dropped. Progressive lengthening of successive PR intervals followed by a drop beat. In case of first degree AB block, we are here seeing PR interval is prolonged. And in case of PR interval prolonged PR interval along with the drop beat, this condition is known as Venke-Back phenomenon. Venke-Back phenomenon will be asked in the question. Venke-Back phenomenon is associated with second degree AB block having features dropped beat and prolonged PR interval. Okay, next, complete heart block. No impulses from the atria reach the ventricle. No impulses from the atria reach the ventricle. Mostly seen in myocardial infarction. The most frequent cause of heart block. It is suspected when pulse is slow and regular and doesn't vary with exercise. That is regular pulse and slow pulse. Regular and slow pulse is constantly persistent in case of myocardial infarction that is complete heart block. Next, right bundle branch block. Here, due to gross hypertrophy or dilatation of right ventricle or from surgical damage, a manifestation of ischemic heart disease is found in case of right bundle branch block. Interruption to the left or right branch of bundle of his causes delay in activation of a appropriate ventricle, causing broadening of QRS complex and characteristic alteration in the QRS morphology. Wide split of SA1, S1 is most often due to complete right bundle branch block. So wide split of S1 is also seen in right bundle branch block. Okay. So from here, we will discuss the rest part of the rest part of the cyanotic heart disease or heart block. We will discuss later in classes. Okay. So good night for today. Thank you.